Okay, so it's just on 10:30 and we've got quite a lot of content to get through. So I'll just start with the introductions whilst other people still come through onto the webinar. So welcome. We're really looking forward to our time with you today, and we do want it to be an interactive session. So please, when we get to our question and answer session, please speak up, or you can use the chat. We've got Chris and Andy that are looking at the questions from our team, and in a minute I'll be handing over to to Rhiannon and Lauren, who are going to take you through our hearing from survivors. How effectively are we responding to domestic abuse? And the kind of information that we'll be using during the webinar is from voice data practice in all the work that we do across the UK. The practice team work alongside local authority areas for a number of reasons when we come in, but it's very much a co-production approach in terms of thinking about how the DA Act has been implemented, is being implemented, the needs assessments, the strategies, how DA partnership boards are working, and everything we do is around voice data practice. So I'm going to give you a very quick overview in a moment of our public health approach, whole system working and how we do that. And then we'll move on to Lauren and Rhiannon in terms of what survivors are telling us. Then we'll go into questions, and then I'll just do a short thank you and some information at the end. So just in advance of that, I'm just going to wait for 2 more seconds because I can see that we have more people coming into the webinar. Just to say we are recording the session. So if there is any issues with that for you, could you just let us know? All of the information will also be available on YouTube. We're going to be doing all of that in terms of sharing it. The slides will be shared afterwards as well. We are going to be emailing all that information out and additional resources. That will take place next week. Please use the Q&A function, which should appear next to your chat button, and we'll either answer them directly or come back to them at the end of the session. Please be respectful in the chat. All delegates have their microphones and cameras disabled and cannot be seen on screen. A recognition that there will be survivors attending the webinar as well, and that we will encourage people to do what they need to for their own safety. So if everybody is happy with that, we'll go on to the next slide. Thank you. Great, so this is our whole picture and public health approach into supporting local authority areas with thinking about a whole picture and the whole person when we're thinking about domestic abuse, because as we know, it's never the some experience or someone's whole situation. So, you know, somebody is a mum, they are a carer, they're a professional, they might be an athlete, they're involved in their local community. There are a million things that those people are involved in, as we all are. So it's about thinking about this holistically, the whole person within the context of the whole family, the whole community, and the whole of society. And that really equates to the whole picture. So when we do our public health approach, we go in, we work alongside, we look at the local system, we look at the culture, we look at all of the policies and procedures, we interview victims, survivors, people who harm, professionals, and we work alongside local areas for about 6 to 9 months in building all of that up into a national picture, which is some of what we're also going to be sharing with you today in terms of supporting victims and survivors of domestic abuse. We work with pioneers within Safe Lives who also help with that work, and we also obviously work with local survivors in terms of how they're experiencing those pathways, accessing services within a local area. So everything is completely around authentic voice and voice data practice, as I mentioned. And I'm going to hand over to Rhiannon and Lauren that will take you through the rest of the presentation.
Thank you, Nikki, and welcome everybody. My name's Lauren and I'm a practice consultant within the practice team at Safe Lives.
And I'm Rhiannon and I'm also a practice consultant.
So we wanted to start today by kind of talking about what is authentic voice. So you'll see some really powerful quotes there, from one of our pioneers and then from one of our AV panel members in Scotland. So that's our authentic voice panel. And one there is, we've walked through fire to get our voices back and we're not going to give them up now. And when we talk about authentic voice, it's the sharing of experience and their expertise, because survivors and victims are experts by experience, and they are here to inform, to educate and to effect change, and they are an essential part of the high quality response to domestic abuse and to the work that we're doing. They're integral to that. We talk about valuing their expertise, their skills and the strength of victims and survivors. And really importantly, it is not an optional extra. It cannot be seen as that or used to confirm your position or beliefs. And as said there by one of our panel members, it's not about reliving my past, but it's about using my past to affect change. And I think that's really powerful and talks to what we're trying to do. So our ethos is around data, voice and practice, which Nikki spoke to, and survivors are at the heart of everything that we do, and pioneers help us to be human, to be rigorous and to be brave. And when we speak out, we are all empowered, and there is no them and us, there's only us. And to create the most effective response to domestic abuse, it's vital to partner the expertise of survivors with the expertise of professionals. And it's integral to ending domestic abuse for everyone and for good. And it's about that redistribution of power, from that power that's been taken away from survivors by perpetrators, those who harm and services, to those survivors having the power to share their experiences and insights, to partner with professional experience. And also, really importantly, remembering that professionals may also be survivors and survivors professionals. And that's what we mean when we talk about there's no them and us. Thanks, Ray.
Okay, so we're going to jump in to look at the data that we have from local areas. So as a practice team, we work in a really in-depth way with local areas across the UK to look at their local response to domestic abuse. And a really integral part of that is gathering that authentic voice locally. And we do that through surveys, focus groups, interviews, speaking to as many survivors as well as professionals and those who harm. But today we'll be focusing on the voice of survivors. And so this slide is data from surveys across 10 areas that we've been in over the last 18 months. And so it's pulling the data together from all 10 areas. And similar themes come up across areas. And so what we can see here is three of the kind of most powerful survey findings that we've pulled out of those surveys. So the first is whether or not survivors agree with the statement that domestic abuse is physical. And a quarter of respondents agreed with that statement. And obviously, because it's a survey, it's these responses are open to interpretation, and we can't fully understand what exactly the respondent was thinking when they answered these questions. But when we look at this finding, it is clear that we need to challenge a conception of domestic abuse as physical violence, and that we need to talk more about coercive control, emotional abuse, financial abuse, and the whole picture of abuse that survivors experience. Now the next one is, we get very similar findings across areas, and is one that is one of the most shocking for us, but also for stakeholders locally, is that across areas 86% of survivors disagreed with the statement that they were confident that they would be believed. So there's a real issue across the board with having that trust that if they were to disclose or to seek help, that they would be believed by professionals. And the final one on this slide, the statement is, it's easy to recognise that you're in an abusive relationship. And 89% of respondents disagreed with that statement. So the suggestion there that actually it's very difficult to recognise when you're in an abusive relationship. And again, this links back to the themes around awareness raising, but also a recognition that, as Nikki talked about in one of the first slides, that domestic abuse isn't the whole of somebody's situation or experience, and they will have a lot of other things going on, as we all do. Children, school, job, bills, a lot of kind of very urgent needs that they need to be dealing with every day, which might make facing up to the fact that they're in an abusive relationship more difficult. A few more statements here, and these are particularly about seeking help. So over 2/3 of respondents said that they knew how to get help if they were to experience domestic abuse. However, only 40% agreed that the right support is available when you need it. So there's a large proportion there who, although they would know where to access support, the right support wasn't necessarily there at the right time for them. Again, this third one looks at feeling believed, and 49% agreed that they felt believed by professionals. So there's that fear of not being believed, which a huge proportion of survivors hold, and then in their actual experiences of seeking help, half in reality still didn't feel that they were believed by professionals when they disclosed. And then the feeling or fear of being judged by professionals. And a third agreed with the statement that they didn't worry about being judged. So 2/3 worried that they would be judged by professionals if they were to disclose. And finally, we also ask about family and friends and wider support networks. And so here we can see that 1/3 of respondents agreed with the statement that my family and friends understand what I'm going through. And again, there'll be a lot of context to those responses that we don't necessarily have in a survey, but obviously it just goes to show that those wider support networks, there might be some need for awareness raising and a greater understanding amongst the public of the dynamics of abuse and what that might look like. Okay, so this is still survey results, and we asked what is most important to you when accessing support for domestic abuse, and overwhelmingly you can see there in blue and pink the two biggest responses were a non-judgmental approach, which goes to the findings from the previous slides around feeling judged and feeling believed, and a confidential service. There's also other things in there that are really important to people, so one-to-one support and face-to-face, 24-hour access, 24-hour access. But the most important is a non-judgmental approach and that it's confidential.
Thank you, Ree, for that. So we're going to move on now to look at the responses and the data that we've got from actually those conversations that we've had with survivors from our focus groups and from our interviews that we've had with them. So we spoke to 58 people across 12 sites, and they have been so powerful and really inspiring and very helpful. So what we've tried to do here is kind of theme them for you to tell you what information is coming out now. We know that there's quite a lot of information and there's lots of quotes on these slides, and there were many other quotes that we could have chosen to kind of show the breadth of experiences. So we're just going to kind of pick out some key points here. So this is talking about positive experiences with services. And I think what comes through really clear here is, again, that reassuring, that non-judgmental, supportive approach, having a named worker, so having that person that you can go to, that they can support you in a better way, as it says there. And also having groups and being around other women, so that peer support that you can have, those that have been in the same circumstances as you, to support each other, and it comes through that peer support is so important. Can I have the next slide? Thank you. And then looking at this is where those experiences may have been not as positive. And again, the key themes coming out of this, and we saw this so much through the data and through the conversations in every area really, was that constant experience of having to retell your story over and over again, and kind of the real negative impact that has on a survivor. There's a quote there that talks about, you know, let's go back over it every time. It's awful, it's harrowing having to relive that experience. So I think we really need to reflect on that. And also about that lack of connection between services, so them just not being interconnected. And again, that goes back to them having to tell their story. So those professionals not talking to each other and not being connected, and then that victim in that situation being bombarded and having everybody contact them is very overwhelming. So how can we link that up to be more beneficial for that survivor? And also that step down and recovery. So one of those quite large quotes there, it kind of talks about, you know, people saying, oh, you should be over it by now, but how do we continue that support after crisis point?
Okay, so we're going to look at several specific themes, and the first one is police and the criminal justice system. And I'm pretty sure that a lot of this won't be new to you, but having this evidence and data from across areas just goes to show that this isn't the individual areas or individual scenarios, but that these are themes that are coming up across the country for survivors from different backgrounds and in different situations. So lots of survivors we interviewed told us about particularly negative experiences they'd had with the police. And this ranged from inaction. So you can see in one of the quotes that in blue at the bottom there, I had some death threats, I reported them, it took them a long time to deal with it. A police officer came to my house and said, well, we're not going to charge him because it's been 3 months and you're still alive. They talked about poor communication between forces, about, again, having to retell their story, going over and over their experiences and the re-traumatizing impact of that. And crucially about a lack of awareness of domestic abuse from officers. And again, in the Navy quote there, somebody an officer said to one of the survivors, well, if it was that bad, why didn't you just leave him? And I just thought, she just doesn't get it. Thinking more broadly about the criminal justice system, a lot of survivors found navigating the court system inaccessible and re-traumatizing. Some people told us that they felt unsafe and unsupported in court, particularly where they were having to walk past or be in the same room as their perpetrator. So again, awareness and understanding of the dynamics of domestic abuse, So I had this old solicitor turn around and say to me, there's nothing you can do. You have to wait for him to get physical again. And that was his advice. And a theme that I think will be familiar to lots of people is that lack of communication about the progress and what is happening with court cases and sentencing. And so this survivor told us that the sentence that their perpetrator received wasn't communicated to them in a timely way. And they said the outcome of that sentence determines the foreseeable for me and my children. And the themes that have come out of our conversations with people locally really reinforce a lot of the findings that are in our recent report that Safe Lives undertook on behalf of the Domestic Abuse Commissioner, called Understanding Court Support for Victims of Domestic Abuse. And so we can share a link to that as well if that would be interesting further reading. And particularly the family court, which I'm sure many of you will have had experiences of. And again, this was raised as an issue for survivors where they'd had to navigate that system. And again, domestic abuse awareness came up. And so you can see there one quote where somebody said, "I've had one CAFCAS officer say that I provoked him into physically assaulting me. He actually stood in court and said that, and no one batted an eyelid." And survivors also talked about the court system being used by perpetrators to continue the abuse, and particularly as part of post-separation abuse in the context of the family court. So it's like their perpetrators' playground, the courts.
So housing was also a theme that came up within the conversations that we were having, and we know that safe and secure housing is such an important part for safety for victims, survivors and their families. And you know, as part of this work, we spoke to many survivors who had real positive experiences with safe accommodation. However, there were many challenges to accessing safe accommodation and to accessing housing in general. So, you know, survivors spoke a lot about having to move and having to uproot their lives, their children's lives, and that feeling like a punishment. And there's a quote here where a survivor says, you know, they were told you need to get out before he comes back. I'm going to give you emergency accommodation, and I felt like I was being punished, being in a strange and familiar place, and actually staying in their car because of the accommodation that they were offered. Multiple survivors talked to us about having experienced homelessness due to domestic abuse, and not being able to access that refuge place, and really the challenges of accessing and navigating that homelessness system. Some survivors were finding that they couldn't access that housing support, and then, you know, then having to make themselves unintentionally homeless by leaving their homes. And the pink quote speaks to that there. So talking about actually had to jump through the hoops of applying for unintentional homeless with the council, and the impact of that on top of everything else that they're going through at that situation. So the marriage breakdown, social services involvement, police involvement, court involvement, all of that. So additional pressures on top of that. And also one of the themes that came out through the conversations that we were having is actually the inadequacy of that emergency accommodation. So many survivors being placed in hotels and hostels, both victims that are single and also those with children. And the impact of that, so many being triggered and feeling very unsafe whilst in those forms of accommodation. And in terms of kind of support within safe accommodation and refuge settings, some felt very, very supported, and others found that support at times was lacking. Other themes around housing that came up is around that long waiting list for rehousing, and that links back to the challenges of getting rehoused, and also challenges around joint tenancies where with the person causing harmful behaviour and the impact of that. So moving on to support for children, again, a really, really important theme, and links back to one of our previous webinars that was around children as victims of domestic abuse there. And this was a real key theme that was that came through again from the survivors that we spoke to. And a real theme was that they felt themselves unable to, they felt not equipped to support their children alone, but then couldn't access the support themselves from professionals. And it talks there kind of, you don't read them in books, you know how to potty train, there's books on that, but you don't see a book on how to manage a child where there's been a witness to domestic violence. And I think that's really, really key there, what support is available as parents, and also that challenge around how you have those conversations. Also, a theme around actually trying to access that support. So talking about, we had a survivor who wanted to, as it says there, trying to put an early help referral in to get their child the support that was needed, but that was blocked by the person causing harm, and as both parents had parental responsibility, that was not able to go any further, so couldn't actually get the support for the child that they need. And child contact and post-separation abuse being a really key factor, and the impact that has on the children and the support available through them. So as you can see there, there's in that pink quote, children still having contact with their dad and they have to deal with him. There is not enough support out there for children who still have to deal with perpetrators. And also survivors kind of express that need and that want for ongoing therapeutic support for their children and young people who've witnessed abuse, because that trauma is still ongoing. So it talks here in the purple quote, she still thinks about a lot of things. It's 2 years on, she gets nightmares. She could have felt that she could have had a bit of prolonged support in school, whereas they'd sort of moved on to the next person by that time after that 6-month period. And also, really importantly, and that links back to what we were talking about earlier with retelling their story and being re-traumatized from that. So the lack of consistency and stability with workers. So, you know, children are having to retell their story and relive their trauma and over again. So there's a quote here where she's, my daughter won't seek any help or won't speak to services because they come, she opens up, and you know what they do, they leave. And that's really, really important. And, you know, it talks there, what's the point of telling them anything? In a couple of weeks, he'll be gone. And so I think we really need to recognise the importance of that stability and consistency with our young people.
Thanks, Lauren. Okay, so thinking now about mental health support, which is something that a lot of the survivors we spoke to said they had needed and that they had sought, but that actually it was very difficult to access. People talked either about very long waiting lists or where they were able to potentially access counselling in particular, that they didn't necessarily have specific experience and expertise in domestic abuse. So the purple quote there says, counselling was a long waiting list, and when I was seen, they had no experience of domestic violence, so I ended up paying for private services. And the difficulty navigating the mental health support system in particular, and coming up against closed doors. And so the Navy quote at the bottom there, they said, you shouldn't have to fight like that to get what you need. I've been fighting for nearly 2 years now, telling them I need counselling. I get in touch and they're like, you can't come to this counselling because you need specialist counselling and we can't provide that. And so people are stuck in a situation where it's been acknowledged that they need support, but that support isn't specialist enough and isn't available for them.
And I think another point around that is that specialist support isn't available because there may be proceedings ongoing. So and we know that takes a lot of time to get through that. So that again, they're stuck for those reasons as well.
One of the questions that we ask when we speak to survivors, which I think is possibly one of the most important questions, is what would their suggestions be for improving the system? And so, having spoken about complicated, complex systems that are really difficult to navigate, about having to retell their story to multiple people, having to contact multiple different agencies. One of the really strong themes that came through was about having a single point of contact. So this person said just one phone call, one person. And another suggestion there was to have your spokesperson. So you tell one person everything and they're always there for you to be able to ring. And you've got this one person's number so that you know you don't have to answer all these withheld calls from multiple agencies. And again, on the same theme, you just need that one person to guide you through multiple areas. And I think as professionals, we can often find these systems difficult to navigate. And so the ability of somebody who has experienced trauma, has multiple different urgent things that they need to be dealing with, and don't understand these systems, it is incredibly difficult. And so kind of before we think about the therapeutic support and the ongoing support that they need, just being able to navigate the system is really, really key. People also talked about kind of person-centered, individualized support. And again, it's that recognition that survivors are individuals and they have individual circumstances and situations, and that there's no one-size-fits-all support service, that we need to be flexible, and we need to be able to offer survivors what they need when they present to services. Another thing that came through is about the experience and the expertise of professionals, and actually what survivors want is people who are compassionate and who understand their experience. So this person suggested that it would be helpful for them to have lived experience, but it's really about that understanding of their situation and kind of where they are at that moment. A suggestion there in blue that rather than having to retell your story, having something that is recorded somewhere, so that you don't have to recall and explain your situations to organisations and professionals all the time. And then picking up on the theme that's kind of been throughout those findings around domestic abuse awareness and understanding the dynamics of abuse, a suggestion that all professionals need domestic abuse training. And this person was talking specifically about legal professionals or people in the family court system, so social workers and CAFCAS workers, but as well as health professionals like GPs and midwives.
So just to kind of summarise those themes that we had from those interviews. So some of the things that also came out is that many survivors did disclose to professionals that they were working within their communities prior to receiving the support that they need. And again, that goes back to the awareness raising there that needs to be strengthened. Survivors sometimes feeling that they were not high risk enough, or that because they were not high risk, then they weren't a priority for the support. As we spoke to earlier, experiences with the police often being very negative around that thing around communication, victim blaming, and not being taken seriously. And again, going back to that awareness of domestic abuse. Once survivors received IDVA support and support from a domestic abuse service, they felt safe and supported. Again, something that we've spoken about many times today is survivors having to tell their stories to professionals multiple times when they're referred into other agencies. And survivors largely feel supported at the MAC and via that process, and they understand that process.
Okay, so as we mentioned, we've spoken to a lot of people through surveys and interviews and focus groups, but we are very aware that we're not reaching everyone we need to hear from. And so we're on an improvement journey when it comes to reaching different communities and people with different backgrounds and experiences. And so we just wanted to kind of talk to who we have heard from and how that compares to the population, and therefore actually looking at who we're not hearing from and how we can look to improve that. And actually we have a quote there from one of the survivor respondents to our survey, who said they need to speak to a range of survivors rather than go off figures. And they're absolutely right. We need to hear from people from across the board in order to be able to provide the support and plan services and systems that meet their needs. So in terms of age, most survivors who responded to our survey were aged between 31 and 50. And in the general population, that age group make up 26% of the population nationally. So at 48%, that age group is overrepresented in our survey. And so there's work for us, particularly to hear from younger people. So only 1% of our survey respondents were aged between 18 and 19, and older people and the 65 and over. In terms of ethnicity, the majority of respondents were white. And so at 86% of the survey respondents, that does tally with the national population, which is 87% white nationally. However, we only heard from 1% of respondents were Black or Black, British, Caribbean or African, and nationally that population is around 3% of the population, and so we can see there that they are underrepresented in our survey respondents, and so there's some work there for us to really push hearing from people from Black communities. The majority of survivors we spoke to were women, and although we know that domestic abuse is a gendered issue, and we would therefore anticipate a higher number of female survivors to respond, we would like to reach more male survivors. In terms of disability, 39% of respondents said they did have a disability, and actually that is fairly representative of the population. Most survivors who answered identified as heterosexual, so there was 85% said that they were heterosexual or straight, and generally in the population that is around 94%. Having said that, there's an estimated 3.1% of the UK population who identify as lesbian, gay or bisexual, and so we can see there that the gay or lesbian respondents are underrepresented in our survey.
So we just want to talk to you about a couple of things really now. So we want to kind of talk about our improvement work, but we're also really interested in hearing your examples of local practice around how you've embedded that survivor voice and how you're hearing from survivors. So we would be really grateful if you have any examples of local practice, if you are happy to share them in the chat with us of things that are working well in your area and what you've been trying and things like that. So if you're happy to do that, we'd be really, really grateful to hear from you. To see how things are going. But as we mentioned, you know, we wanted to talk to you a little bit about our improvement work, because we acknowledge that the way that we are working as a practice teams means that we're not speaking to a representative number of people. So we acknowledge that the survey, it's an online survey, so that means that those who don't have access to the internet, whilst we know that local surveys show it as widely as possible, those without access to the internet and those without access predominantly to social media aren't able to use that survey. And also, you know, whilst it is shared, not, as we heard earlier, not everybody is aware of services. So they might not know where to find that survey, or might not, you know, be aware of their situation at the moment. For those where English is not their first language, or they have accessibility needs, so possibly a learning need, then this survey can be really difficult, really challenging for them, or completely inaccessible. So we're having thoughts about how we can do that. In terms of the interviews and conversations that we're having with people, accessibility needs around language, they can be easily accommodated with kind of interpreters. But actually, one of the biggest challenges that we have is who we actually hear from, because we hear from those who have access services, and predominantly mainstream services. And we know that many victims, particularly those from marginalised groups, they don't access mainstream services. So how do we hear their voice? How do we get their voice? And how do we provide them with the opportunity to share their experiences and their expertise? So this can, you know, include involving your local by and for specialist organisations, and not just those that are within the domestic abuse sector, but actually also those that are working in the community, where survivors may already be accessing their services and feel safe in that environment. And one of the things that we've also seen is that there's a view on kind of the type of victim that we should speak to as part of our work, and who is put forward to speak to us. One of our AV principles, which we'll talk about in our webinar coming up in next year, is around speaking your truth. And we want to give all those who want to speak to us and to use their voice an opportunity to speak their truth, or, as our AV panel member said to us earlier, using their past to affect change. And this sometimes means hearing from those who may not have received the best service, or may have experienced multiple disadvantage, and therefore we need to adapt how we engage with them to provide them with that opportunity to speak their truth. We need to hear the voices to ensure that their voice is at the heart of everything that we do, and embed that within our work. And so that we are providing services which work for and with survivors and victims, and not services which are done to them. And we are currently working on a suite of practical tools for supporting with survivors to share their expertise and their voice, including guidance on how to create spaces for survivors to meaningfully affect change, and how they can use their voice. And as I said, some of that we're hoping to have a webinar next year, which will talk more to that piece of work. So I can see that there's been quite a few things put in the chat that kind of Ree's coming up for us here. So thank you very much for everybody for sharing that with us.
Yeah, there's some great stuff in there. So there was one example where you have a survivor talking to professionals as part of their training, which is a brilliant model. And I think we've spoken about the model in Safe Lives and the term we use of pioneers. And I think it works incredibly well for professionals to be able to hear that firsthand from survivors. So when we work with local areas and we are feeding back our findings to a local area, we'll do a workshop with stakeholders, and normally it would be kind of strategic leads on their partnership group. Having survivors in the room to talk to that group is so incredibly powerful, particularly where we have local survivors. And often it's the first time that they've heard firsthand from survivors, and you can just see the power of their voice and the impact that they're having. And so I think that's a brilliant model. We also had somebody was saying that you deliver Own My Life in Devon, and that the phrase authentic voice is helpful and kind of gives a name to what it is you're doing, which is great. And so yeah, as Lauren mentioned, we'll be talking more about authentic voice and how you can embed that locally in an upcoming webinar. So do keep an eye out for that. And a really interesting and useful point here, that locally you are hearing voices, but the issue is about how you use that to influence change, because they're not being heard. And I think that's absolutely right. And I think when you look at the authentic voice principles, there's things in there about kind of create, not create. So often what we do is we ask survivors and service users across lots of different services to feedback and tell us how well we're doing. But actually what we want to move to is that model of co-creation, so that they are part of planning, designing, decision making. And again, where we are kind of involving survivors when we're talking to strategic leads is really powerful. And if you have a way of doing that and getting those people in the same room, it is honestly so powerful, isn't it?
Yeah, it really is.
Is there anything else that's come in?
Somebody has talked around about peer support groups to follow on from their recovery programs that's run by service users, by and for service users, which is really positive. And we talk a lot about step down in recovery and that need for that peer support. So that's really positive to hear, and hoping to address the issue raised here of survivors feeling dropped after services end and continuing an empowering recovery journey. Somebody's talked here about a survivor feeling let down by children's services and police, but that one officer made her realise that she was a survivor and she said it saved her. So really, really positive example there of support. And another area talking about deliver Own My Life as well, as Journey Beyond Abuse, and talking about peer support as well.
Yeah, so I think what's really key, and I would guess that most of you kind of are totally on board with this, and the challenge is, how do we get this message up to kind of decision makers and to that partnership group, but that by involving survivors, hearing their experiences and their voice, actually we can respond better, more effectively, more efficiently. And so there's a really strong case there for doing this, because it is the only way that we are going to respond effectively. And that's kind of the message that we need to be pushing.
So I think that's everything in terms of the things that have been popped in the chat, which is really helpful. Thank you so much. We really appreciate you getting involved and sharing that with us. It's really helpful. Somebody's talked about a Facebook Live event as well, including that.
Brilliant. It sounds like there's a lot of really good stuff happening, and I think what would be great is if we can continue to share that, because by sharing between areas what's working and what's not. And we'd be particularly keen to hear from you if you have any examples where you are reaching those voices and individuals who we don't often hear from. Because obviously, as we've mentioned, that's the journey that we're on. So if anyone has any kind of great examples of what you're doing, we'd be really keen to hear from you. We're going to move on to questions.
Great, thanks ever so much, Rhiannon. We just do a bit of a quick summary before we go into questions, and it's brilliant to see some of what you have been talking about in the chat, and some of what we have been finding is interesting, just talking about training and understanding of domestic abuse in people's roles. So we can see that there's a real disparity in terms of training. We can see that 97% of frontline professionals would say for probation that they've received training in the last 2 years in adult domestic abuse, compared with under half from education, and then quite low in that actually is also health. So it's interesting that you've raised that, and thank you. And I think that we, the more work we can do with health to make that training compulsory, but also more generally within your system and wider systems, what level of domestic abuse training that is going to help people understand domestic abuse, understand the levels of risk, and also kind of thinking about more about the types of domestic abuse beyond physical. Absolutely key, really. The other things I just wanted to kind of pull out before we go to questions is really thinking about that, which has come out throughout, is the survivors partnering with you really creates that effective response to domestic abuse. And we know that you're all experiencing a lot of change in systems at the moment. There are many challenges, but there are also opportunities. So thinking about integrated care boards and the moves to place-based delivery, and the role of hyperlocal communities in how that can play out, because those are the places where people are, those everyday conversations. How do we reach in? How do we think about those new roles in communities like social prescribers and health coaching? That can be the first point of contact. And now also potentially, if home visits are included within that, how and within those contracts with primary care networks may be the first point of contact. So what are the opportunities? We also often see inconsistency in terms of data collection. So when we think about victims and survivors telling their story once, how you collect data, the information sharing agreements that are in place to enable that to be shared between professionals that might be working around that person, really also key to in supporting those people on their journey with engaging with the system. And it's great to hear about business, because more and more business engagement and their role within systems and local communities are massive. There are, if you're in an area where there's a large employer, they will be potentially supporting or engaging with a large number of people that are experiencing domestic abuse. So how are we engaging business into our system, and how is that feeding into the domestic abuse partnership boards? How can they be used in terms of supporting DA champions and other initiatives that they may be having, as well as supporting them with policies and procedures? And it was also great to hear about all the stuff you've talked about, the tools about where people are and how we can have conversations with them, like Facebook, is absolutely brilliant to hear about. We often also hear about one person being the difference, and it was, again, hearing about a police officer or someone that is key and has the confidence to have that conversation and then build on that trust to enable a victim or survivor to be able to share their experience. And I guess we've also now got a new layer as well in terms of the cost of living on from COVID, and thinking about the new risks for a much wider group of people that may have become more vulnerable. Also, the different risks that may be involved in that. So we've heard on our sector calls for domestic abuse, people less able to travel, unable to get away, having to stop broadband, or stop phone contracts. So increasing isolation and potentially the reduction in the ways that we can communicate with victims and survivors. So how can we, as a local system, in your local area, think about providing potentially different points of contact? We know as well that older victims and links with things that are just happening out there at the minute with thinking about staffing issues, so potentially reduction in care packages or increased risk due to isolation. If you're older and more vulnerable, that increased risk of economic abuse potentially. And we also know that older victims take twice as long to report. And then potentially is also about a culture of reporting that may not have existed back when they were younger. So how can we support those different groups of victims within our communities, as well as differences between rural communities and inner city communities, and thinking about some of those cultures? I live in a rural community, so the fishing community and the farming community will interact very differently with call services than perhaps if you're living in a town or a city. And within that, different communities will also engage very differently. So how are we talking to the communities where we live, where they live, and how they will engage with services? The integrated care boards do provide a massive opportunity to think about that integration piece. And the other thing, it's also just to say, building on Lauren and Rhiannon and what we've heard from victims and survivors, it's not easy to identify you're in an abusive relationship. And I'll speak to that from experience. You are managing and surviving and dealing with the normal day-to-day issues, as well as managing what is happening to you as a victim of domestic abuse. You love that person, that's why you were there in the first place. Family and friends may see small, seemingly unconnected situations, as do you, for different phases of that relationship. So it's not always obvious to that person that's in that relationship that what they're experiencing is domestic abuse. So how we give information, how we signpost, how we support, how we have those conversations is key. And also thinking about know them and us. So when we think that of the numbers of people that experience domestic abuse, if you're a professional and you're experiencing domestic abuse, it's very difficult to share your experience within a network of professionals that know you. So how can you have effective policies and procedures and safe spaces within your organisations? The victims and survivors may be committed in different ways that we can't see, through tenancies, mortgages. It may be they may well be aware that if they do know that they're experiencing domestic abuse, it's going to trigger a set of consequences like criminal or child protection. And also that has to be seen in the context of how we're supporting them. So that it comes back to how we understand domestic abuse, how we work in a very person-centered way, and how we really support victims and survivors to be able to survive, not just survive, but also to thrive. So one of the questions I'd like to pose before we move to your questions is really, what are the strengths of your organisation or responses? How do we know what best practice looks like in our services? How effective are our relationships with partner agencies, including police, children's services, specialist domestic abuse services, and third sector organisations? What are our caseloads like, and how is that impacting on the type of care and response to survivors and victims? And how do our organisations also promote self-care? So those are just a few to pose, and I'll hand over back to Rhiannon and Lauren to run the questions.
Thank you, Nikki. There was somebody who's just posted to say that they are a newly appointed engagement worker, and so this is kind of a core part of your role. Please do keep an eye out for that next webinar, because they will be covering an introduction to the authentic voice principles, and then also looking at different models of building authentic voice into local areas. So I think that'll be really, really useful. There was a logistical question. Are slides going to be shared? Yes, they'll come out next week, so you can get those.
Yeah, and somebody agreeing with you, Nikki, about recognising and saying if only survivors knew this about each other, and recognizing and admitting it being one of the hardest things. So thank you for sharing that. And so I think in answer to some of your questions, Nikki, kind of talking about the size of caseloads for staff, caseloads being really high and overwhelming, and also I suppose around that being a professional as well, that your relationships can be different depending on your status in the organisation, and maybe how you're able to have those conversations as well with people. Somebody's talking here about good working relationships with health advisors within the hospital, which is really positive to hear and to see, and training for professionals around domestic abuse and the difference between that and parental conflict, and also training being delivered to many employees and many services across South Wales.
Just a question that's just come up. When will the next webinar be? It'll be in early next year, 2023. So that date for that will come out as soon as possible. If anybody has any questions and is happy to talk, do keep putting them in the chat, but also we can actually have you ask a question in person if you do have one.
I think is there some actually in the question and answer section? Let me have a look here.
Where respondents in the survey answered that women-only spaces were important to them, I'm curious whether there was specifically over whether that includes transgender women and non-binary people, or was cisgender women only. It's really difficult for us to know what people meant when they're responding to surveys. So obviously it's a lot easier for us when we're doing interviews and focus groups to kind of dig into what people mean. So I think we'd be misrepresenting people if we tried to answer that. But obviously that's a really topical question and something that the sector is grappling with. And as an organisation, it's a piece of work that we're working on too. I mean, I don't know if anybody has any insights on that, on conversations that they've had with people, but I wouldn't want to try and suggest what people meant by that, because it's just impossible for us to know from the survey responses.
Nikki, we've been asked if you can repeat your questions, if that's okay.
Just having fun with my IT at the minute. I can repeat my questions, and I was also just going to add that we will have a public health approach report due out early in the new year, which will have some of the best practice that you're asking about. And we can also, in our next webinar, share with you a journey and the different points of intervention that also would have made a difference. So happily to take that back, and we can incorporate that into our next webinar. So in terms of the questions that I asked you just to consider, were what are the strengths of your organisational response to domestic abuse? Do we know what best practice for our service looks like? How effective are our relationships with partner agencies, including the police, children's services, specialist domestic abuse services, and third sector organisations? What are our caseloads like? And I thank you for sharing that. You know, absolutely, we hear that caseloads are very high and probably unlikely within the sector, that's the feeling anyway, to return to pre-COVID levels. So the volume of cases and the complexity of cases that we're seeing is likely to continue. So I guess also that talks to the need to continue to work together more collaboratively and think about some of that innovation also that COVID brought about in terms of breaking down some of those organisational barriers. So how do we continue to build on that? And does our organisation promote self-care? And I'm really happy to share some of those questions when we send the presentation around, just for you to have that to consider.
Thanks, Nikki. So there's a really interesting question. How do you recommend professionally challenging when you come across bad practice around domestic abuse? And I think it very much depends on your relationship. So if you have a good relationship with another professional and you're able to just raise it with them, we see some really good practice in MARACs where the professionals around the table have a good respectful relationship and the abilities to say, I'm just going to challenge the phrase that you use there because I think that's kind of, it's victim blaming. And you know, where the relationships are good, that works effectively. That's not always the case, obviously. And so I'd suggest using your multi-agency partnerships. And so what you should have in your local area is a domestic abuse partnership group, and that'll have leads from key agencies across the system. And your agency will likely have a representative on that group, so you can feed that up and they can share that at that strategic level. If it is in a forum like MARAC, the MARAC will have an operating group where the governance for the MARAC sits. So that's another place that you can escalate that kind of thing. So it's not always easy. If you can do it in the moment and in a kind of supportive way, I think that's always the best way to do it. But sometimes that isn't possible and we don't feel confident or comfortable to do that. And so I'd say use the structures, the domestic abuse structures that exist in your area to raise those kind of things.
And also using kind of your structures internally. So when Nikki talks about self-care and things like that, so use you could go to your line manager and seek support from that and have those conversations and look at it that way. And is there support that your manager can offer you to speak to the manager of that service and things like that. So make sure that you're following your kind of internal support structures as well about your well-being, because that can always be quite a challenging conversation. So to remember the self-care for yourselves as well.
I think somebody's made some suggestions there as well about what they might do, whether it's a safeguarding issue, whether it's a training issue. So thank you for those suggestions.
Some really supportive information sharing here about kind of Lloyd's and stuff like that. So thank you very much for that. That's really helpful. I think somebody's kind of asked around measures being put in place to support trans women and non-binary people and how they're accounted for in future surveys. And as I said, that's a piece of work that's ongoing at the moment in terms of how we improve how we're collecting that data. So that is an ongoing piece of work at the moment in terms of improving our contact with people. Just having a look at any other comments here. So I think, yeah, people have talked about an answer to Nikki's question, kind of cuts in funding, real life value of funding, staff being overwhelmed and doing the best that they can. It's very hard to have that person-centered approach when there's insufficient staff to keep taking cases long term.
Thank you for sharing those links. Do you keep sharing anything that you have access to? That would be great.
Yes, I'm just checking if there's any more questions. Is there any more questions that anybody would like to ask?
Any advice for how to navigate anger in client survivors when, as workers, we're also angry about police response, for example? I mean, I think we'd all agree that having looked at a lot of those quotes and experiences that people have, anger is a very valid response to some of that practice. And I think the challenge then for professionals is how do we use that to kind of get a good outcome for that survivor. And I think obviously we would know that working with other professionals, that might not be the most constructive way to get for them to get what it is that they need, because they might end up being labelled as angry or not an easy person to deal with. And so I guess your role as an advocate is to kind of represent their views in a way that will get them the outcome that they need. It's difficult.
One of our colleagues is just talking about kind of examples of actually how one of our pioneers was able to use their anger and frustration, and actually that led to them being involved in some of our programs, some of our training programs, such as that. So kind of, again, like we spoke to before, kind of using their experience to affect change, so actually channeling that, and then being able to use that experience to support others.
Gemma, do you want to come on that?
Yeah, I can. So my name's Gemma. I'm Authentic Voice Coordinator at Safe Lives. And I think, like Rhiannon just said there, anger is often a very, very valid response to very poor service. And so absolutely, we've had one of our pioneers was in a situation with a really negative police response. And what they did was actually went to challenge it. And I think there's something about taking anger and looking at where it goes. So it's either understanding why something is the way it is, and actually, is that something that can be changed, or is that something that's long term? And so they got in touch with some of our DA Matters trainers, and DA Matters is our culture change programme that we run with police forces across the country. And they were actually, I think, the first survivor to share their story as part of DA Matters, to really bring it home about this is what's going on locally with survivors in your area. This is how they feel about this response. These are also their suggestions for how that could be improved. And they are actually really doable suggestions. And that has really developed into something huge for them, where they're now part of a network of survivors who've shared with the police across the country. They're part of our pioneer group. They're supporting other people locally. And I think it does show that there is something about recognizing that something is not right, and how we can potentially turn that into something productive if that is what someone wants to do.
Thanks, Gemma. That's great.
Thank you. So yeah, somebody's kind of just saying thank you, Gemma, for kind of chipping in on that. That's really helpful. We've got a question here about restorative justice being piloted and being encouraged locally if relevant and appropriate. I'm kind of asking our thoughts in terms of reflecting the victim's voice in a very direct way. So I don't know whether Nikki or Gemma, you want to come in on that at all?
I know that, I don't know if you're working in Scotland, perhaps. I know this has been a recent discussion in Scotland, and you might hear from my accent, that's where I'm based. And there have been lots and lots of discussions going on around that. It's a huge, it's a really challenging topic, because for some people, very much what they want is the ability to ask questions and to get some answers from a perpetrator. And that's a really natural thing to want as survivors. And obviously that needs to be very much managed in a safe way, and recognising the dynamics of domestic abuse and coercion. I don't know if there's anything else you want to add in from that, Nikki.
No, I would agree with what you're saying, Gemma. What I do think we could do afterwards is, when we send some links and some of these questions we can take away to give some answers when we send around the slides next week, to give you some more detailed information about and where best practice may be developing, what's happening in this space. So we can put all that together for you as some resources to have a look at.
Thank you.
There's a question there about any free training available to help us improve our practice and raise awareness with colleagues. I think the first place to look would be your local council. So most local authorities, whether it's delivered by them or by the specialist domestic abuse service, will have multi-agency domestic abuse training, kind of basic level, that professionals from across different agencies should be able to access. And if that doesn't exist or you're not able to access it, again, that's something that I would escalate to your partnership group. If those structures aren't clear, then that's something to kind of look at locally, I think, because it should be clear in each local authority area who your partnership group is, who sits on it, and how to contact them. I don't know if you know of any other free training sources.
No, I think like Rhys says, the majority would be kind of via your local authority or maybe your safeguarding board, so your safeguarding adults board or your safeguarding children's board, with that information there. So I think that's all the questions that we've had. Unless there's
Great, thank you. I was just going to add as well, people have brought up potentially, some issues that may be concerning them. So it is just worth thinking about, is that safeguarding, what does poor practice in your organisation look like? Can you speak to your manager about it? Is it consistently poor? Is it a service issue? Is it a training issue? May a person need some more training? And also within your organizations, whatever sector that is within, is also, what is that in terms of strategic leadership? Is there the opportunity to have DA champions? We're seeing that an awful lot more now, that have that kind of strategic overview. What's the culture within your organization in terms of reporting? And kind of just thinking internally within that organization, how that's working. So what are the systems and the processes you can use? Because it is very difficult to challenge if you're an individual within an organization, and it's much better and supports you to be able to work through a system or process that can do that with you, alongside you, or for you if you see something that's happening that you have a concern about. So important to use those things that are there for you. That's all I would really say. I don't know if there's anything else that anybody would like to raise. It's been brilliant to hear from you. We will pick up every comment in the chat, and if we can and we have additional resources, we will add to the answers and the comments that have come today alongside the slides. You've also got other things like Safe Young Lives, Your Best Friend, our Cry for Health reports. And as everyone is talking, I've been thinking there's probably some other links that we can put in and some tools that may be able to support you. And we'll have a look at any other training that we're aware of as well. But we'd really like to thank everyone for participating. Thank you ever so much to Rhi and to Lauren for facilitating this session. It absolutely wouldn't be a session without all of your contribution though. So thank you for making that so interactive as you have. It's been great to be part of that this morning, and it's always amazing to hear from everybody. So thank you once again. Enjoy the rest of your day.
Thank you, everyone.
Thank you.